So, just under 2 weeks ago, I went to Madrid to join Europe's largest NGO organisations, Mental Health Europe's general annual meeting. That's when members are invited from across their membership, which is vast. All countries in Europe can be represented, and they share their report, their planning for the next year or so, their budgets, and invite questions from the audience and members about the current workings in the way they work. So that wrapped up. It was really important for member accountability, and my general agenda going there was about co-creation and active allying, and not being just buzzwords about policy papers that they need to be practiced internally. In the meeting itself, I stood up to challenge Mental Health Europe's current approach around kind of engaging particular organisations across their membership. Right now, relying on mass emails that kind of go towards everyone, and you have to have the opportunity to read it. I pointed out the very small team we have at Youth Mental Health don't always have the capacity to read these newsletters, which are incredibly informative and brilliant, but we don't have the capacity to see them and read them and capture them all the time. I pointed out that we're, as Europe's leading youth mental health NGO, we're often left out of youth-focused meetings in Brussels, or even things like their Young Leaders programme, which they're currently running, and conversations about that, often because we miss those emails. And our belief was that Mental Health Europe need to be doing more to proactively be seeking out organisations that work with specific demographics if the conversation or if the project calls for it, whether it's young people, refugees, LGBTQ community, etc. In the meeting, the great news, Mental Health Europe recognised this in front of all the attendees who were there, and listened and kindly and empathetically understood where we were coming from. And I think it was shared across the community, across the membership, that other teams are quite small as well, and so often we miss those exciting opportunities. The Secretariat and the leadership of Mental Health Europe said they're going to move away from passive email sort of culture around their members, and are going to be using a customer relationship management tool in order to cluster the groups, knowing who to contact specifically if specific work comes up, and they are the sort of specialists or a good organisation to communicate with in regards to that work for projects and opportunities. So that was really exciting. Forwards, so hopefully we'll get to see this going forward, and Youth will be more engaged and proactively brought into some of the work that Mental Health Europe do, as they are the ones with the access and the open doors to those big policymakers, members of parliament, and conversations across Europe. And so the reason we want to be members with them is so they can help pull us into those conversations, and the young people that we work with, to ensure that young people's voices are appropriately and meaningfully involved and aren't just kind of tokenistic conversations. Every organisation in Mental Health Europe has their specialities, whether it's the country they work in or other areas of demographics. So we're looking forward to hopefully working more with Mental Health Europe and being brought in to engage a bit more with their Young Leaders programme, and seeing where we can support and work together as that comes to a close this year on their end as a funded programme. And we work with young people outside of funding, so it'd be a good collaboration. So we're looking forward to it. Watch this space.